When used properly and under the guidance of a healthcare provider, birth control can be a powerful ally to prevent pregnancy and get menstruation under control. However, over the years, we've questioned its safety and side effects, as we should with any medication. Of note, many women have wondered if birth control can increase the odds of infertility. Is there any validity to this notion, or is it merely a myth? What's the connection between birth control and fertility problems, if there is one at all? Let's find out. So, what's the relationship between birth control and infertility? While research is ongoing, many reliable resources state that no, birth control does not cause infertility in previously fertile women. Birth control could mean birth control pills, a birth control shot, implants, patches, IUDs, and vaginal rings. For instance, the Cleveland Clinic says that hormonal birth control will not affect your ability to get pregnant. Information published in the American Journal of Epidemiology echoes a similar conclusion, stating that neither the duration of use of oral contraceptives nor the age when birth control is first used affects future fertility. Other research published in Oxford Academic gives us even more promising information. Long-time use of oral contraceptives before a planned pregnancy is linked to a decreased risk of a conception delay. So, where does this myth come from then? Why do we worry that it could be harder to get pregnant after stopping birth control? Well, what sometimes happens is that birth control masks other problems that would affect fertility otherwise. For example, if you have irregular periods, birth control pills can help make them consistent, but it won't fix the problem. Once you stop using birth control, the problem, whatever it was, can return. It's the same situation with symptoms of PCOS and endometriosis. In particular, birth control pills, as opposed to other forms of birth control, help some women preserve fertility by decreasing the risk of ovarian cysts, preventing endometriosis from getting worse, and reducing the risk of ovarian cancer. So imagine that you have underlying health issues like endometriosis and you start taking birth control pills. The health issues seemingly go away. Then you get off birth control because you want to get pregnant and you can't. It's easy to see why many of us make a connection and assume that birth control causes infertility. In reality, something else was causing infertility and birth control simply hid those symptoms. Remember that birth control isn't a solution to problems with your menstrual cycle. If you had menstrual cycle irregularities before starting birth control, those problems might very well come back. This is why it's important to see your healthcare provider if, after stopping birth control, you also stop having a normal menstrual cycle or start experiencing symptoms. Now, you might know that there are different forms of birth control, one of which is hormonal birth control, which we've already provided examples of. Birth control pills, the birth control shot, etc. Does it matter whether or not your method of birth control contains hormones? No, this still won't affect your future fertility and your ability to get pregnant. What can you expect when stopping birth control? When the next morning hits and you don't take your pill, should you be able to get pregnant almost immediately? If you were using an implant and got it removed, do things instantly go back to the way they were? Not quite. If your birth control contains hormones, you should give it 1 to 2 weeks. That's about how long it takes for the hormones to leave your body. There is one type of birth control that may lead to delayed conception after discontinuation: the shot Depo-Provera. The birth control injection gives you a very large progestin dose that is meant to prevent pregnancy for 12 to 13 weeks. This makes Depo-Provera one of the more long-acting forms of birth control, so some women might not get pregnant for a few months after stopping birth control. In more extreme cases, it can take a couple of years, but this is very uncommon. However, if you think you might fall into this group, speak with a fertility specialist. So, what type of birth control is best for women who want to eventually get pregnant? As you now know, even prolonged use of birth control shouldn't impact your fertility. More than likely, a few weeks to a few months after stopping birth control, fertility returns. This means that the type of birth control you use comes down to personal preference as well as any guidance your healthcare provider might give you based on any pre-existing health conditions. Birth control pills are the most common form. However, some women aren't a fan of oral contraceptives because you need to remember to take them around the same time every day. Missing a day of oral contraceptive pills means you need to use another form of birth control, like condoms, until you take your next pill. Intrauterine devices or IUDs are another option. If you want to explore an intrauterine device, do your due diligence and speak with your provider. Learn about what it's like to get an IUD inserted and removed. If you choose this form of birth control, ask for a local anesthetic when you get it inserted. Many women report pain and discomfort, which can be prevented. Barrier methods are another option. Barrier methods quite literally provide a barrier that stops sperm from entering the uterus. These forms of birth control include external or internal condoms, diaphragms, cervical caps, and sponges. Additionally, there's the birth control shot, Depo-Provera. This hormonal birth control is similar to birth control pills in that your body senses the hormone production coming from the injection, so it stops producing its own. One shot can prevent pregnancy for about 3 months. The birth control implant is about the size of a matchstick and it works in a similar way. Now, what should I do if I can't get pregnant after birth control? Whether you've used birth control pills, intrauterine devices, the implant, or another form of birth control, it shouldn't lead to impaired fertility or have any other negative impact. If you had a normal menstrual cycle prior to starting, you should ideally go back to that once you've stopped using birth control. If you stop birth control and have a hard time getting pregnant, speak with your provider or a fertility specialist. They might ask about your previous contraceptive use and may check your hormones with a simple blood draw. eNational testing offers a fertility tracking panel with results available in 4 to 10 business days. Order online today and find a testing center near you.